Good afternoon, everyone. Thank you for joining Concord Regional VNA and Central New Hampshire VNA and Hospice for this public listening session. I'm Martha Tecca. I'll be your moderator today. Please note that this session is being recorded. This forum provides an opportunity for the public to learn about the proposed merger of Concord Regional VNA and Central New Hampshire VNA and Hospice, and to ask questions and answer, and also offer comments. Before we begin, I'd like to provide a few logistics. For those of you who joined the session online using the Zoom link, your camera and microphone are automatically disabled. You'll be able to see and hear our panel, but they cannot see and hear you. If you joined by phone, your line is muted. We'll begin the session with a brief presentation, about 20 minutes, followed by the question and comment session. I'll explain how you may ask a question or make a comment when we get to that portion of the program. We're getting terrific technical help from Montaigne Communications, making sure that everything is running smoothly. If you have a Zoom technical issue at any time, you may ask those questions in the chat function on the Zoom panel. Again, this session's being recorded and will be made available afterward for public viewing at the following link: www.vnaforthefuturenh.com. We'll share this URL in the chat box on your screen, and I will read it again later in the program. Now I'm pleased to introduce our panel. Beth Slepian is CEO and President of Concord Regional VNA. Lisa Dupuy is CEO of Central New Hampshire VNA and Hospice. Melvin Severance is Chair of the Concord Regional VNA Board of Trustees. And Kristen Gardner is President of Central New Hampshire VNA and Hospice Board of Trustees. I'll now turn over the session to Beth and Lisa, who will give a presentation on the proposed merger of their two agencies. As a reminder, panelists will take questions after the presentation. We'll take just a couple of seconds to get the presentation up on your screen, and Beth and Lisa will begin.
Thank you, Martha. I will begin. Good evening or afternoon, everyone. Thank you for joining our listening session as we give you a little bit of a background on our journey to partnership between Central New Hampshire VNA and Hospice and Concord Regional VNA. Next. I'm going to start by telling you a little bit about Central New Hampshire VNA and Hospice. We're located in the Lakes region, and we service 43 towns around Lake Winnipesaukee. We have an operating budget of about $8.4 million. And last year we did just under $1 million in community benefit. And for people that may not know what a community benefit is, it is programs and services that we offer to the community for health promotion and education that are no fees are collected for it and are free. Our net assets were just under $14 million. And we currently are located in 2 towns. Our parent is in Laconia and our branch is in Wolfboro. Both buildings the agency owns. Next. Central offers home health, hospice, pediatric, and maternal child health programs. Our home care census runs around 280 to 300 patients, and our active daily census of hospice is approximately 55. 75% to 80% of our revenue is from the payer of Medicare. We also service Medicaid and commercial insurance payers. And Central employs approximately 100 employees. Next.
Hello, thank you for joining us. I echo Lisa's appreciation. Concord Regional VNA has been serving 44 towns in Central New Hampshire for the past 120 years. We have an operating budget of approximately $36 million, and our community benefit investment in the community last year was over $5.1 million. We utilize our community benefits to support our hospice house, And we also create innovative programming and partner in our mission with organizations in the community, such as Catch Neighborhood Housing, to improve the wellness of residents in our community. It also includes flu clinics, senior health clinics, and other programming. Our net assets are $38 million. Our main administrative building is located in Concord at 30 Pillsbury Street, and we have a 20-year lease with Concord Hospital, which is where our hospice house is located. Next slide, please. Our home health census is approximately 1,100 patients. Our community hospice census is approximately 120, and our hospice house is 10 beds, running at approximately 96% occupancy. 71% of revenue is Medicare, and we provide services as well to Medicaid, commercial insured, and other payer sources. We have approximately 400 employees. Next slide, please. We are a member of Capital Region Healthcare, which is a collaboration between Concord Hospital, Riverbend Community Mental Health Services, and Concord Regional VNA. However, the three organizations run independently of each other. Our services include home health, hospice, pediatric and maternal child health. We have private duty, a robust community health services program, and a palliative care program in conjunction with Concord Hospital. Next slide, please. This slide represents our service areas. Central New Hampshire VNA and Hospice services 43 towns around Lake Winnipesaukee, and Concord Regional VNA serves 44 towns in Central New Hampshire and the Capital Region. Next slide, please. This indicates our combined service area, which is the red, and we only overlap in 8 communities. So we do not overlap in a large territory. Next slide, please.
So when the two organizations came together for the conversation of a potential partnership, and through some due diligence, what came out was the what. And the what would be one single entity by merging Concord Regional VNA and Central New Hampshire VNA. This combined entity would have a change governance documents which would reflect both the heritage of both of the parties and the terms of the merger agreement. Donor restrictions will continue to be honored, and the operating revenue at the time of the closing of the merger would be used in the service area in which they were generated. Next. The next part of the conversation and through the due diligence was why. And we felt that the merged entity would enhance the provision of the mission and would be able to increase the services to all the communities we service. Next. How will this transaction improve the access to quality and affordable health care? Well, first, it would allow resource depth. It would help fill some clinical gaps and shore up our services. It would definitely increase our workforce retention and recruitment. And by increasing our revenue, our census, and shore up our costs, it would improve our service costs per visit. It would also expand services, and it would allow access to the hospice health in the Lakes region. This merger would also strengthen our referral relationships. Also, by this two financially stable organizations coming together and merging as one, we feel that there would be sustainability for the long term. Next.
We then began a discussion for governance integration, which would guide the merging of the two organizations and the Board of Trustees structure. So our guiding principles were related to board composition, which would be intended to reflect a fair representation of the service area covered to ensure greater community input and support future board recruitment. We would be committed to a diversity in board member skill set, gender, ethnic, and age diversity, 3-year terms, and the board could and should use non-board members to serve on select board committees. Next slide. The initial composition of the board will be an agreed upon portion of the new board selected by each entity, and major decisions would require a supermajority vote. Next slide, please. Management integration. The leadership that would be proposed is I would become the CEO of the new entity, and Lisa Dupuis would be the Chief Operating Officer. The structure fit with organizational planning, and both Lisa and I have strong operational skills and similar leadership values. The executive leadership team would be developed by Lisa and myself collaboratively, and it would lead to the integration of both organizations' leadership teams. Next slide, please.
I would like to just inject one quick correction to one of the things I had said. I said operating revenue. It's actually operating reserves would stay within the communities they were raised at the time of closing, just to correct myself.
Thank you, Lisa, and thank you, Beth, for that very helpful overview of the proposed merger of your current organizations and the proposed merger. We'll now begin the question, answer, and comment portion of the program. To accommodate all of the attendees who wish to speak, we do have over 100 people on the call with us today, which is on this conference, which is really very encouraging. We ask that you keep your questions or comments to 2 minutes or less. If you have a follow-up question or comment, we will get you back in the queue and we'll do our best to get back to you at that point. When you do ask a question or make a comment, please state your name, your town of residence, and your organization if appropriate. Now, there are 3 ways, and I see some folks have already started. There are 3 ways that you can ask a question or leave a comment. And I'm going to start with one that's happening right now, and that's folks putting things in the chat. And I just want to encourage you, if you are going to enter your questions in the chat, please make sure that you include your name, include your where you're from, and also your organization. We do encourage you, if possible, to say your question or comment out loud to us. And there's 2 different ways to do that. The first is on the Zoom screen. You can raise your hand. There's a function that you can click. That's a raise hand function. It's on the bottom of your attendee panel. Click that and hands will raise. I see them going up as we speak. That's very helpful. If you're on the line, you can use if you're on the telephone line, you can unmute yourself and get yourself in. You can't unmute yourself, but you can get yourself in the line to be unmuted, in the queue to ask questions by pushing *9. *9, that's a little bit different than sometimes you're asked to use *6 to unmute yourself. So *9 puts you in the queue to ask a question. I'll walk through those questions that are coming in and also pepper in some of the ones that are coming in on the chat at the same time. So let us go ahead and get started. Actually, we also, as you may all know, we invited some questions and comments as getting into this process. And one of those that came in was from Michelle Dufort of Concord. And she just said, we look forward to hearing from community members on this. And of course, so does everyone on this team. So that's a really nice way to get started. BJ Entwistle is the first raised hand. And if you could, you're unmuted now, and will you go ahead and share your name and where you're from, and please ask your question.
Sure. BJ Entwistle, I live in Canterbury, New Hampshire, and I'm on the Capital Region Healthcare Board. You talked about the 2 leaders figuring out the executive teams, leadership team, and what would the process be for that? And are you going to do basic full retention of jobs in both organizations? Or am I misunderstanding what the leadership team is?
No, so hi BJ, thank you very much for your question. You know, we are committed to our workforce, and we do not have plans to reduce our workforce. We both feel that we have very talented leadership and management teams, and we are committed to making sure that the talent is retained and utilized in the best manner. So I think that everybody will be probably relieved and pleased when they see the structure of the organization roll out.
Thank you.
Next up, Headley, Lee White, I'm sorry how you're signed in. Thank you. I think you're unmuted and may go ahead and begin. Or maybe you need to unmute yourself. Have you muted yourself on your line?
There we go.
Can you hear me now?
I can.
Yes.
Okay. My question is, what do you, both as leaders, see as the cultures of your organizations? Because I think that's critical to the future of any merger.
All right, thank you, Lee, for that question. Looking at our cultures of our two organizations, we feel that there's a lot of similarities in the cultures. Concord and Central work together over the years. We're members of an organization where we come together and we do a lot of processes together, quality, IT, and work groups together. So we collaborate on a lot of levels already. So I think that our cultures are well aligned to move forward in this type of arrangement.
I would also add that we are both very mission driven, committed to the communities, and want to see both organizations come together so that we are sustainable and will continue to be able to serve the communities. We are aligned in how we deliver care in many respects, and our staff have worked together in the past. So we feel also through the board discussions and the board groups that a lot of synergies have been identified already, and we feel we can work on that and continue that.
Thank you very much. Margaret Frankhauser has a question. Margaret, are you ready? And do unmute yourself if your line is muted on your side as well.
Can you hear me now?
Yes, ma'am.
Yes.
Okay, great. Well, I'm Margaret Frankhauser. I'm a resident of New Hampton, and I'm the former director of Central New Hampshire VNA and Hospice. So I'd first like to make a comment and then just pose a question. And the comment is that I fully understand the reason for a merger. I think this is a very challenging business in the world of healthcare, and I think these are two wonderful organizations that have been working together very closely for a number of years. So I'm very much in support of a merger. But I think an important question for a community member is, how would a merger possibly benefit people in the community? I think that's always the key question, is what does it do for the community? So thank you for the opportunity.
Thank you, Margaret.
Thank you, Margaret, for that question and your comment of support. We really feel that as one organization and being sustainable for the future, coming together, that we have a lot to continue to offer the community. It would be sustainability, but as well as services. There are some differences in our services, and by coming together, we would meld those services and they'd be available to all of the communities that we both service as one entity.
Margaret, we are looking forward to bringing our community benefit programs for the community up into the Lakes region. I think that is something, an asset that we bring. And then we also do have some specialized clinical programs that the Lakes region would also benefit from as we come together.
Thank you very much. I'll ask one quick question from the chat, or one comment that's from Donna Davey from Concord. She says, I'd be concerned that opening up the hospice house to the central area would mean that there will not be enough room to accommodate the Concord regional area, which keeps it at 96% capacity now.
So I want to clarify the hospice house and eligibility. Currently, we do have patients come from a large service area and are able to accept patients from central New Hampshire if they choose to come to the hospice house for their care. So we are not concerned about access. That is certainly something that we will continue to look at. But our patients do come from outside of our initial region as well. There are only 2 hospice houses in the state. And so it is a benefit really to everybody. So we would continue to monitor that, look at access, and ensure that people can benefit from those services.
Okay. We have a telephone caller. Can we unmute that line, please? And please tell us who you are and where you're calling from.
Sure. Good afternoon. My name is Rosemary Hurd. I'm the President and CEO of Catch Neighborhood Housing. At the outset, I would like to commend both organizations for pursuing a merger here. We're much stronger together, and obviously the footprint of service is greatly enhanced by this. And I just want to tie into something that Beth said at the outset. We happen to have an incredible partnership with the Concord Regional VNA on a program called PASS, which is Positive Aging Through Home Supports. And this is a pilot program that we have at our only age-restricted property. And the impact of this has just been incredible for our residents. And I hope to see other programs like this throughout the new footprint together. It has just been something that is so valuable and can be replicated in other places. So I think with a stronger new entity, perhaps that will be possible. My other question, rather than the comment that I just made, is how will this new entity be identified? Will Lakes Region still have its own name, or will there be a new entity for this going forward? Thank you all for the work. I know that this is an enormous undertaking to get to where you are today, so thank you.
Thank you, Rosemary, for your support and your question. The name remains to be determined. We are extremely sensitive to the heritage and the history of both organizations. And so we will, as we move forward, over the next few months, understand greater how we can best represent the new entity, both in name and how we create a brand in the new area. So
I'd like to just add too is that, we do not want to jump to a name. We want to really work on it together as the 2 entities come together and make it meaningful that both organizations have set that in our first step to moving together.
Thank you. I have one from the chat. I'll just read exactly what she wrote. Hello, my name is Lisa Glotty. I'm from Franklin, New Hampshire. I work for Dartmouth Hitchcock Clinic in Concord as a practice manager for the surgical specialties. I was wondering how the leveraging of resources will help us with coverage for patients with post-operative care, as well as ability for expansion of community-based clinics.
Thank you again for your question. We feel that coming together will really allow us to better support the communities. So what we are seeing in Concord is many patients are coming to Concord Hospital for their care, and we are receiving referrals to service an expanded area. And we are challenged, as everybody else, with a workforce. And by coming together, we can really leverage our workforce and make it efficient to make sure that we can bring all of the programs into the surrounding areas. We're eager to be partners. We're looking forward to that, but we do think that with the scale that the organization will create, that we will be able to better serve the specialty clinics, the surgical needs, and we can move forward with innovative programs.
A couple of other chats have come in. I want to name them so that we have them on the recording. I think that some of the questions, I think you've addressed them, but if you feel like you'd like to expound on those answers, please do. One is from Betsy Reinhardt from Hopkinton, New Hampshire, works at Concord Hospital. Thanking you for the helpful overview and asking about how the community and she says, and New Hampshire as a whole will benefit from the merger. Do you want to expound on that from a New Hampshire perspective?
Sure. So, I think we are all well aware of the aging population in New Hampshire, and we are dealing with a future that will require significant investments into population health and the infrastructure that really will allow us to deliver care to people in their homes. It is not just the care, though. It is the wellness programs, it is the community health education, and it is also the programming that we can put in place together to make sure that we can meet those needs. I think we also can be a model for New Hampshire as a whole in healthcare, and where home health and hospice can look towards the future in a positive way of coming together and being sustainable so that organizations can continue to provide the necessary care in the community. We know it's cost effective. We know people want to be at home, and we hope that this sets an example for care throughout the state.
I'd also like to add that, as a larger organization, we'll be able to better service the community and the rapid changing of the industry. There's a lot of other changes within the healthcare industry. There's regulatory changes, payment changes, and as a stronger organization with more support and resources, we'll be able to make those changes to then be able to continue to be around long into the future.
That's very helpful, Lisa. And the next question here online says Central VNA is an important partner to LRG Healthcare and to the entire Lakes region. This is from Kevin Donovan, President and CEO of LRG Healthcare in Laconia. And he was asking to expand upon how Central VNA and the joint communities will benefit from the transaction. It sounds like you addressed that, but I didn't know if there had anything specific in response to Kevin's question.
I think we've covered a lot of that. I just feel that together as one organization with, again, a broader depth, we'd be able to, people from the Lakes region are leaving to go to get healthcare other places. And we want to be here in the community for when they come back to their home and be able to get that care. And I think that this type of partnership will allow that.
Thank you. Jessica Barker from North Sandwich is moving to Laconia in June, and she is asking also about the new name and what contact numbers should be used. So I don't know whether you want to put a contact number out there that she will certainly be served now while she's here or on the call, or whether we want to, since she's on the call, will she receive that we'll make sure she's able to receive that contact information. What's the best way to do that?
So first, as we go through this process, somebody can always visit the website that we're giving, the www.vnaforthefuturenh.com. As we go through this process, updates, questions and answers, comments, everything will be posted there so that everyone has one place to go to see where we are within the process. At this point, we are still two entities, so if you need to reach out to one of us, you can find us on the web. You can reach out to either one of us if you need services, or if you have any questions, you can call our either Central's main number or Concord's. But again, to stay educated on where we are with the process, the best thing to do is to go to the website.
Terrific. Thank you very much. And that is there in the chat. Again, we'll come back to that later. Another message from the chat. This is from Jay Mullins. I live in Hopkinton and I'm on the CRVNA board for the past 6 years. I believe this merger has a strong business rationale. As the delivery of care becomes more complex with ever increasing technology and regulatory demands, this combined organization will be in a better position to meet these demands, he says. The next message here from Margaret Pritchard to all panelists. She's from CEO of Lakes Region Mental Health Center, wondering if the programming with partners, if some of the programming with partners in the Lakes region could or should be expected to expand, as I think both organizations have worked hard to collaborate and integrate services. Can we expect more of the same with the new entity?
Thank you for your question. I think the first thing I'd like to say is we are approaching this partnership coming together for sustainability. We are not coming together as a growth opportunity. So if that is your question, should we expect more expansion? That is not in our plan, certainly not at the moment. I think we are committed, both Lisa and I, to creating relationships, both new and making sure that the old relationships that both organizations have are well cared for, and to understand what the opportunities are, and again, move forward in how we deliver care. We know, I mean, certainly how we deliver care today is very different than how we delivered care in February of this year, as we all can appreciate. So I think our first step is really to understand what the ongoing needs are and how can we best meet them and create new opportunities.
Okay, thank you very much. We have a couple of hands raised to offer their questions. Mark Laval. You are now, we've got you unmuted. I think you need to do the same on your side, Mark. Go ahead. Mark, are you trying to speak? We can't hear you if you are. I don't hear Mark at the moment. So we can come back to him. I think he's muted at the back at the moment. And we had Lee White, who asked his question earlier. Did you have something else to share or to ask, Lee?
Yes, I do. I'm generally a very positive person, but I'd like to ask a question just to see if there's any disadvantages to this merger. Nothing happened.
Yep, we heard you, Lee. We're just sitting here.
Caught him by surprise.
Thank you.
I have not come across any yet. To be honest, I'm not saying that there isn't something that exists, but we have not come across that. Everybody that we've talked to about it has been very positive, has said positive things. Haven't come across anything negative at this point. You know, we continue to remain in all three offices. We'll be continuing to serve all of the communities we service, and I think just in a stronger way. So I'm not sure I found any negativity in that yet.
Lee, this is, I just wanted to echo Lisa, but I also want to be clear that we don't think it's going to be easy. So, you know, we know there will be challenges. I think we have found this to be a very positive experience between both boards, between both organizations, and also the community support we have seen. I think our negative is not doing something and really taking the future and doing this in positions of strength, not in a position that we need to. So I think there are absolutely more positives, although, like I said, we don't expect it will be easy.
Thank you very much. We have a couple more hands raised. A caller. There we go. Go ahead.
Yes, hi.
Tell us.
This is Rosemary again.
Oh,
I
hi,
would just like to
Rosemary.
go back to one of Lee's earlier comments around culture and corporate culture as it relates to a merger. And I would just like to share something with the group. Having been through 3 mergers in the private sector and 1 merged function in the nonprofit sector, one of the things that we found incredibly valuable, albeit that we thought we had, 2 cultures that would naturally come together, when we really got down to brass tacks, we found that that was not necessarily the case. And so we brought in a corporate psychologist to work with the 2 groups. And we found that it was incredibly valuable, money really well spent. And I think that that's the one area that in which mergers do fail and are challenged going forward, because one group or another changes in some way. So if there is money in your budget to consider doing that, I would highly recommend that moving forward. I think it's a great way to give everybody a voice at the table and to dispel any myths and get everybody rowing in the same direction. Thank you again.
Thank you. Mark Laval, it looks like the hand's raised again. If we'll give it another shot to see if you're able to get unmuted and speak. You need to unmute your line as well, or yeah. I'm not sure why we can't hear you if you're.
Is it the *9 feature? Do we need?
Well, he's actually on Zoom.
Okay.
And his mic is unmuted and we've unmuted, so I'm not sure. Do you want to try, Mark, to leave it in the chat, since for some reason we're not hearing you on your microphone, through your microphone? Thank you. Brian Winslow is in line to ask a question, or?
Yes, this is Brian Winslow. I work for Central New Hampshire VNA and Hospice. I just wanted to comment on Dr. Lee White's question about disadvantages. In all my discussions with supporters and community members, there hasn't been really anybody talking about the disadvantages, except for the disadvantages if it doesn't happen. And I wanted to really point that out, that there certainly are some disadvantages if this doesn't happen for both agencies. And even if we start and can't finish, there are some disadvantages. But when it comes to actually accomplishing this, there are no real disadvantages that I've identified. So I just wanted to comment. I didn't have a question.
Thank you. I have a comment in the chat. This is Melissa Reap, 18 years employed as a home care nurse with CRVNA. How will this change my day-to-day work life? I have a hard time imagining how this will affect me.
Hi, Melissa. Thank you for your question and for joining us. I think you will continue to deliver care in the manner by which you always have. And I would not expect that your day-to-day life will be changed. Certainly there will be, opportunities in this. We would like to bring our certified services into the central New Hampshire and catchment area. And so I think it will create opportunities actually for our employees and Central New Hampshire's Central New Hampshire's employees for growth and development. But in day-to-day work life, you're caring for the community, and we would not expect that to change.
Thank you. It looks like BJ has another question. Don't forget to yeah, there you go.
Thank you. It's a follow-up culture question. Rosemary touched on it. I was part of an organization once where the boards couldn't get along. It was a big merger. And so it's a similar question about the boards of the two organizations. It's easy to think that that part of, the two parts of New Hampshire are very different. Probably they're not as different as we think. And I love Rosemary's comment about get some help if you need it, because that it just helps to keep talking and take advantage of what sounds like a terrific opportunity. But the question is about the boards as opposed to the institutions themselves.
You want me to take that one, Beth?
Sure.
The boards have worked together now for several months in terms of discussion about what would be normal operational elements and technology. But we spent a great deal of time together talking about the people and the people in the communities, the people in the organizations. And one of our main concerns originally was that we wanted to do this with doing no harm to anybody or any program. And we've spent a great deal of time at the board level making sure of that. And we have been unbelievably lucky to have Beth and Lisa and a great board from Central to work with and have this discussion. So although we probably could use all the psychological help in the planet, but if a part of that, if we get that opportunity, that'd probably be great. But at this point, we've been comfortable working with each other, and we're coming down to working on an agreement, and we'll see how that goes. But everybody has really seen the value in this process.
Kristen, you're nodding, but did you have anything to say? You could unmute yourself.
I was looking for my unmute. Yeah.
Okay.
I would just want to mirror what Mel said, that I think the boards do have, our missions are very similar. I think that both boards are very committed to this project, and I think that we have anticipated some, issues. We've talked about them, and I think we've done a really great job at giving each board their say and their ability to, input, and that we're not being swallowed up, that Central is not going to be swallowed up by Concord. So I feel like they've been very, receptive to us, and I think we've worked really well together.
Okay. That's lovely. I have a question from Christopher Parkinson, and it comes in two pieces, so I'm going to read both of them. Could you address competitive aspects of Lakes Region Visiting Nurse Association, who's the former trustee from CRVNA, and he said he wanted to clarify. I'm sorry, I'm scrolling through many comments. Clarify the point. Understanding is that Lakes Region Visiting Nurse Association has grown quite a bit in the last couple of years. Will they be a threat to us in the Lakes Region? How will we compete against them? What differentiates us versus them?
Hi, Chris. Thank you very much for calling in and posing that question to us. I think both of our organizations have really focused on the strength of what we bring, and to our strength and our ability to be successful in the region is to bring high quality care and programming to the Lakes region. And through our partnerships with our referral sources, our talented staff, I think that we will be able to do that. One thing that does differentiate Concord at the moment, and hopefully together, are the community benefits that we bring to the regions that we serve. I think that really does differentiate us from many of our colleagues and competitors, and we will continue to be committed to that. Certainly we deal with competitors all the time, both in the for-profit and non-profit world, and we have to deliver the best care and understand our communities. And I think our commitment will lead us forward. again, as I said, this is about being stronger together from positions of strength, not a growth transaction. And so as we move forward and create those relationships, I think we will be identified as the leader of care in the community.
I'd like just to add that competition is good. It's not a bad thing to have competition. One, keeps you on your toes. Two is, there's a lot of positive things to having competition. So.
Thank you. And I'm going to add one of the comments that came in through before the session. Susan Houghton from Alton Bay, Central New Hampshire VNA, wrote in with a few different questions, but one specific one of hers that I wanted to bring up at this point was many of the towns on both sides of the lake are rural and or summer resort communities. And how will this service area be incorporated into a new, larger, in quotes, big city, comparatively speaking, VNA?
I'll begin, Lisa, and then certainly please add. So I want to mention that, our service area includes very rural areas, both in Washington and Hillsborough. So although we do service Concord, I do think that we consider ourselves serving the rural community. These are things that we need to work together to understand our community, but I think what's very important is the care will remain local. We have the same staff who are living in the communities that we're serving, and so the care will still be delivered, and we hope as we come together and develop our culture together that we learn to appreciate the differences and address those in our programming. So it's an opportunity for us to be able to come together in that manner. But I would say that, our staff at Concord who were in Washington today would not feel that they're working in the city, that they are treating rural New Hampshire. And just to give you also an understanding, our staff last year traveled 1.5 million miles to care for our community. So if we were caring in a city environment, I would not expect us to cover that much ground.
Well, and I also think the other point to make on that is that our staff are remaining and will continue to be in those communities. It's not that Concord staff's going to come up and work in Wolfboro or Ossipee. So the workers that are living in those areas are going to continue to service those patients, and that those cultures will remain of those communities.
Thank you. We have a phone caller with a hand raised.
Hi, this is Rosemary again.
Oh, okay, sorry.
Rosemary Hurd from CAP.
Rosemary.
I live down the street from Jessica Parker, actually, in Sandwich, New Hampshire, albeit that I run an organization in Concord. So I'm very familiar with the Lakes region, obviously, and the challenges up here. We are a seasonal community or seasonal communities, and residents ebb and flow. And so I wonder if it's appropriate to say that this merger will also help with some of that ebb and flow that we see from summer to winter. We're very aging communities up here. So I would think that this would also bring some stability to the Lakes region as well because of that. Working together may really help in that instance as well.
Thank you, Rosemary. I just want to comment that, we too have gaps in our staffing, and that we see the advantages of not overlapping, but sharing those staff to serve the community.
Thank you. Jessica Barker from North Sandwich, who asked a question a little earlier, asks, who proposed this merger? Did Concord Regional VNA approach Central or vice versa? And she apologized if it was already mentioned, but I don't think that was already asked.
I can take that one. Beth and I are colleagues. We sit together on a lot of different organizations and the Alliance and that earlier we had mentioned we're together and do things together. And we started having a conversation. What if? What if? And so it was kind of a mutual discussion and said, as challenges are happening and as we had a major the way we're reimbursed change in January of 2020, we talked about if we were to become one organization, what would that look like and how would that work? So it was a mutual coming together.
Okay. Lee White again. You need to unmute yourself as well, Lee.
There I go.
There you go.
I'm going to pass because the question I was going to ask was just asked.
Oh, perfect. Thank you very much. And the caller again, I think, is that Rosemary?
No, actually,
Oh,
you got me
that's
the
the
last
first
time. Thank
three
you,
numbers.
though. Thank you.
So you're all set? Oh, okay, terrific. Sorry, the hand was raised again, so I wasn't sure, sorry. Okay, I have no more questions at the moment, no hands raised, no phone lines asking to be unmuted, and no additional chats at the moment. What I'd like to do is share a few of the comments for the purposes of the recording that came in advance. All of them at this point have been answered, but I'm going to quickly read those. And then if you do have another question that you'd like to share, please go ahead, or if you haven't yet had an opportunity, please add those to raise your hand, ask for it to be unmuted, *9, or put it in the chat. So Norma and Ron Davio from Allenstown said, what effects would it have on coverage? Which we did answer. Susan Houghton from Alton Bay, as I mentioned, answered a few different questions. Currently is a community, says the Central and New Hampshire VNA currently has a community presence in Laconia and in Wolfboro and addresses the specific needs and reflects the cultures of those two very different communities. How will this be affected by a merger with a much larger VNA that is focused on the capital region? Will the merger bring a culture shift? We talked about her question about the summer resort issues of the potentially being impacted by the merger. And then will the service stay the same or improve? And in so what ways can we expect? So those, I think you did a nice job of covering those through others' questions already. Kristen Haley from Concord asks, will there be any changes in employee positions? And those were the questions that came in advance. So I think they were all pretty well addressed. We have a hand raised again.
Yeah, sorry to be hogging the line here. My parting question is timing moving forward. Where do you see the next steps and the timing of a formal kind of operating merger going forward?
So I can answer that. We're right now working on the definitive agreement, and your comments and your feedback are part of that. So the two boards, once the definitive agreement is worked out, the two boards would vote on that in order to move forward on filing a change of control notice with the state of New Hampshire. We're anticipating that to be about mid-July. At that point, the Division of Charitable Trust will do their due diligence, and will have to make any modifications that may be brought up through that due diligence. But once that is done, we're anticipating, if all goes smoothly, to become one organization by the end of this calendar year.
Thank you very much. And Mark Lavelle has asked his question here in the chat. Mark from Bow is a former CRVNA board member, current community member serving on the investment committee. I learned a lot listening, however, do have a specific question. What does CRVNA get out of this merger?
Thank you for your question, Mark. You know, I think that we all are working in a changing environment, and the assumption that a large organization is sustainable for the long haul, you know, I think would be a mistake for us. So as we look towards, you know, being around for another 120 years, we feel that this coming together would support our staff, provide opportunities for growth and development for both organizations. We'll fill staffing gaps. I think we all see that in the work environment, you know, in the environment that we're in with nursing shortages and others. I think in the world of the COVID pandemic, which nobody asked us about, being a larger organization and having actually different communities served, which would have actually helped support our workforce because we each have different challenges in that realm. We want to be able to support our partners as, you know, care is being delivered in the community. And we really feel that by moving our and being able to expand our community health programs and community benefits, will really be creating a positive and healthy environment for New Hampshire, for the region in both central capital region, both the Lakes region, and really fulfilling our mission and being able to continue the work that we're doing. So we feel that we actually will be getting a lot out of it.
Thank you. A few more questions have come in from Corinne Smith from Wolfboro and a board member. Without infringing on other agencies in their territories, would the merger present opportunities to expand the patient catchment areas?
At this point, it's not a merger for growth. It is really to come together for sustainability and for increased services to the communities we currently service. So at this point, it's not looked to increase our catchment area.
Chris Parkinson writes, did you want to speak to that? Chris Parkinson writes, because it's aligned with this question, he says, I think it's an excellent opportunity, totally support it. Beth's comments that it isn't for growth, and Lisa's makes me wonder a bit, as I think if things are done right, growth should follow. But as I noted, I'm totally in support of it. Make sure communication is kept up, as this quite often is an area that creates problems. Keep your staffs informed about what's going on.
Thank you, Chris. You know, I think that we are trying to keep our scope in check and understand really what the needs are in the community. And so I think that, you know, growth sometimes becomes a natural extension of good work. But as we said, you know, we are approaching this as a better way to serve our current communities and looking towards the future and what the opportunities will hold.
Thank you. Jessica Barker, again, with an operational question. Will the employee benefits be merged and health insurance change if both organizations have different health insurance providers? Which provider will be chosen for the newly merged organization?
That's all work that is done as the entities come together. So we will ultimately, you know, be one organization, which would lend itself to one employee benefit package and, you know, pay scale and all of that. So we can't speak to where that would be. That's all the work that comes after the definitive agreement occurs, and we can begin looking at integrating the organizations.
I have one more comment here and one hand raised. I'll start with the comment. On behalf of Wolfboro Area Chamber of Commerce, all the best to you with moving forward with this significant merger, from the Executive Director, Mary DeVries. And we have I'm sorry, 2 more calls coming in. 2 more questions before the raised hand, if that's okay. Mark Laval again. As to bylaws, the new entity will bylaws of the new entity, I'm sorry, will former board members with expired term limits be able to be considered for board positions in the future?
So part of this whole process and the definitive agreement is to come up with new bylaws for the new entity. So I don't know that they aren't final yet, so I don't necessarily have that answer. I'm not sure that yet it could be possible.
Thank you for that idea.
Okay, it looks like we have one more question and or comment from Margaret Frankhauser. Don't forget to unmute yourself, Margaret.
Yeah, I have 2 unmute buttons there.
Yeah,
I just want to make one comment. I've heard a lot of comments to you about the importance of being community responsive. And what I'd like to share is I've had an opportunity to live outside New England for several years now. In most of this country, home care and hospice are provided by for-profit providers. And they may be very good providers, but their commitment at the end of the day is not to communities. This is a strengthening of the nonprofit resource in the state of New Hampshire in home care. And that is a gift of enormous proportions. A very strong nonprofit network helps to assure that community needs are the primary reason that the organization exists. So I think that a merger of the two that helps to strengthen that nonprofit network is absolutely critical and will continue to provide community responsive services that would not be provided were it not a nonprofit.
Thank you very much, Margaret, and thank you for everyone who has been stuck with this call and listened to all the questions and asked so many helpful questions and answers to clarify things for, I think, for the panelists as well as for others who are listening in. So thank you, thanks all very, very much. Before we say goodbye today, I would like to offer each of you panelists an opportunity to offer any closing comments in summary. Lisa, would you like to begin?
Sure. I just want to thank everybody listening, and especially those that chimed in with comments or questions. I think they were all great things to consider. Definitely gives us some feedback to take back as we're drawing up the definitive agreement. And I really appreciate everybody taking their time out of their day to give us that feedback.
Mel, did you like to say something?
I'd like to also thank everybody for their interest and their participation, and remind everyone that we've got a management team at both organizations that have worked extremely hard to bring this to fruition and to bring this to a targeted outcome. And we all both have phenomenal folks in our organization that will probably make this possible. And I can't again thank the support and activity of all the board members. It's been a great effort, and we have a long way to go, but we have a great foundation in place.
Thank you. Kristen?
Yeah, I would say the same thing. I thank everybody for participating and asking the questions. I think Beth had mentioned earlier, both organizations are coming from a position of strength. Not to say that there aren't going to be some challenges. Obviously, we are going to be merging. We're going to be one entity, but I think that really the common goal is there, that we want to serve our communities. We want to do it better. We're constantly being bombarded with new rules and regulations, and it makes the job more difficult when you have to commit resources to those administrative kind of back office things. We really want to get people on the ground and providing the services, and I think this merger is right on the money, and it's going to allow both organizations to be able to serve their communities together as one.
Beth?
Thank you. I want to echo everybody's comments. I want to thank you all. Nobody mentioned COVID-19, so I think I did, I believe once, but that was a nice break from that work we've been doing. I want to reassure everybody that, we are taking your input. We'll use it as a guide for our path forward. And from our perspective, it's been a very positive experience working with Central New Hampshire, both their management team and the Board of Trustees. And we look forward to the future. I think our commitment to providing the best care for our communities will really shine as we work forward through the definitive agreement and coming together as one organization. So thank you.
And thank you very much to all the panelists. I know on behalf of several of the folks who have written in for your candid and helpful, informative responses. And to everyone who joined the call today, on behalf of Concord Regional VNA and Central New Hampshire VNA and Hospice, thank you all who joined to listen, to ask questions, to offer comments. We value and appreciate your interest and your input. Thank you all again for sharing your vision for a combined organization, panelists. And if you have additional questions as attendees or comments about the proposed merger, you may submit them through a contact form, which is on the website that's been mentioned a couple times. It's in your chat, right? We'll put it one more time at the bottom. And I'll say it twice now, so that if you're just listening in, you can write it down. It's www.vnaforthefuturenh.com. That's vnaforthefuturenh.com. As I mentioned earlier, the complete recording of this listening session will be posted on that website. Thank you again. Be well and enjoy the rest of your evening.